Hey everybody, it's your favorite doctor, Dr. Tiffany Butler, and good day. So I'm answering some common questions I get while in clinical practice and when I'm out engaging with the community. So one of the questions came up. I was doing a conversation. A young lady visited the booth and she was telling me about her friend. Her friend was going to see a chiropractor for shoulder pain, and she didn't know that chiropractors can help people who have shoulder pain. So the question is, can a chiropractor help someone with shoulder pain? If so, how? All right, so the spine is a weight-bearing joint, and the spine is where the upper extremity, your arms, and the lower extremity, your legs, connect to your spine, right? By way of the shoulder girdle for the upper extremity and by way of the pelvis for the lower extremity. Now with the shoulder complex articulates with or connects to the spine in the mid-back or thoracic spine by way of the scapula. And if there is tightness of the muscles that go from the spine, the mid-back to the scapula, that can affect how well your shoulder girdle moves or your shoulder blade moves when you're moving your arm up, raising it, when you're reaching out, or even what we call retraction, pulling your arm back. And if there's any disruption in the joints in terms of how well the joints move within the spinal column, or even how well the joints within the shoulder complex, particularly that junction, we call it a scapular thoracic junction, moves, it can affect mobility. And anytime there's an impact in mobility, it will affect how that area functions, right? So if it hurts for you to move, or you can't move as well, or if you have like kind of funky movement, like you don't move as smooth, it can affect how well your shoulder functions. And in turn, if it's dysfunctioning, right, not functioning properly, it can put you at risk for injury. So the idea behind chiropractic care, of course, we always analyze the spine first, and then we'll look at the extremities, the shoulder, the elbow, and so forth, to see what's the best way to help free up that immobility within the joints so that you can function better. All right, so that's how chiropractic care can help you. We deal with really it's neuromuscular skeletal conditions or complaints. It's really a biomechanical type of dysfunction that happens. And when you want to rehab someone, it's three things that you have to do. You have to strengthen, flexibility, and stabilization. So those are three things that need to be incorporated into your treatment plan. Anytime you're seeing a chiropractor, you need strength, you need flexibility, and you need stabilization. And that way you can improve your flexibility, improve your strength, but as well as stabilize the joint to reduce your chances of re-injury or the recurrence of pain or dysfunction. Hopefully I answered that question. Continue to create a great day. And as I always say, the healthy mind, a healthy body creates a healthy life. Till next time, stay healthy.